Atrial fibrillation, AF, is a common and often serious heart condition that affects the rhythm of the heart. It is characterized by an irregular and usually rapid heartbeat, which can lead to poor blood flow and increase the risk of complications such as stroke, heart failure, and other cardiovascular issues. Atrial fibrillation occurs when the electrical signals in the heart become disorganized, causing the atria, the two upper chambers of the heart, to contract rapidly and irregularly, instead of in a coordinated manner. Causes of atrial fibrillation. There are several potential causes and risk factors for atrial fibrillation. Some of the most common causes include heart-related conditions, conditions such as high blood pressure, hypertension, coronary artery disease, heart valve disorders, congestive heart failure, and a history of heart attack are closely associated with AF. These conditions can damage the heart muscle or disrupt the heart's electrical pathways, increasing the likelihood of arrhythmias like AF. Age. The risk of developing atrial fibrillation increases with age. Older adults are more likely to experience AF, which is why the condition is often found in individuals over the age of 60. Other medical conditions, certain diseases, including diabetes, thyroid problems, especially hyperthyroidism, sleep apnea, and chronic lung diseases, have been linked to an increased risk of AF. Lifestyle factors, excessive alcohol consumption, smoking, and a sedentary lifestyle are known to increase the risk of atrial fibrillation. Overuse of caffeine or certain stimulants can also contribute to triggering episodes of AF. Genetics. A family history of atrial fibrillation or other heart-related conditions can increase the likelihood of developing AF. Other factors, surgery, especially heart surgery, and infections that affect the heart can sometimes trigger or worsen atrial fibrillation. Symptoms of atrial fibrillation. The symptoms of atrial fibrillation can vary from person to person. Some individuals may not experience any symptoms, while others may have noticeable symptoms that can interfere with daily life. Common symptoms of AF include palpitations, a sensation of irregular, fluttering, or racing heartbeats is one of the hallmark symptoms of AF. This can feel like a rapid or skipped heartbeat. Fatigue. Due to inefficient blood circulation, many people with atrial fibrillation experience a general sense of tiredness or fatigue, even after getting adequate rest. Dizziness or lightheadedness. Irregular heart rhythms can cause reduced blood flow to the brain, leading to dizziness, fainting, or lightheadedness. Shortness of breath, difficulty breathing, especially with physical activity, can occur due to poor heart function. Chest pain. Some individuals with atrial fibrillation may experience chest discomfort or pressure, which should always be evaluated by a healthcare provider to rule out more serious conditions like heart attacks. Weakness. A general sense of weakness may result from the heart's inability to pump blood effectively. Types of atrial fibrillation. There are several types of atrial fibrillation, each varying in terms of how long it lasts and how it affects the individual. Paroxysmal atrial fibrillation. This type of AF comes and goes, often lasting for less than 24 hours. In some cases, it may stop on its own without treatment. Episodes may occur irregularly. Persistent atrial fibrillation. This type of AF lasts longer than 7 days and typically does not stop on its own. It may require medical intervention to return the heart rhythm to normal. Long-standing persistent atrial fibrillation. This type of AF has lasted for over a year and may be difficult to manage. Permanent atrial fibrillation. In this case, the irregular rhythm cannot be corrected or controlled, and long-term treatment focuses on managing symptoms and reducing the risk of complications. Diagnosis of atrial fibrillation. Atrial fibrillation is diagnosed through a combination of patient history, physical examination, and diagnostic tests. The most common diagnostic tool is an electrocardiogram, ECG, which records the electrical activity of the heart and can identify the characteristic irregular rhythm of AF. Other tests may include Holter monitor, a portable ECG that continuously records heart activity over 24 to 48 hours. Echocardiogram, an ultrasound of the heart that can assess heart function and detect underlying conditions such as valve problems or structural heart disease. Blood tests, to check for conditions that may contribute to AF, such as thyroid dysfunction or electrolyte imbalances. Treatment of atrial fibrillation. The main goals of treatment for atrial fibrillation are to control the heart rate, restore normal heart rhythm, and prevent complications like stroke. Treatment options vary depending on the type and severity of AF, as well as the patient's overall health. Medications. Rate control, beta blockers, calcium channel blockers, and digoxin are commonly used to slow down the heart rate. Rhythm control, antiarrhythmic drugs such as amiodarone or flecainide are used to restore normal sinus rhythm. Anticoagulants, since AF increases the risk of blood clots, blood-thinning medications like warfarin or newer agents such as dabigatran or apixaban are often prescribed to prevent stroke. Electrical cardioversion, in some cases, a shock to the heart is used to reset the heart's rhythm to normal. Catheter ablation, a procedure where a catheter is used to destroy the tissue responsible for the abnormal electrical signals in the heart. Surgery, in rare cases, surgical intervention may be necessary to treat persistent AF or to address underlying structural issues in the heart. Lifestyle changes, avoiding alcohol, managing stress, maintaining a healthy weight, and addressing other health conditions can help manage AF symptoms and prevent further episodes. Complications of atrial fibrillation. Atrial fibrillation can lead to serious complications if not properly managed. Stroke. The irregular heart rhythm can lead to blood clots forming in the atria, which may travel to the brain and cause a stroke. Heart failure. The inability of the heart to effectively pump blood can result in fluid buildup in the lungs, leading to shortness of breath, fatigue, and swelling. Other cardiovascular problems. AF increases the risk of developing other heart-related issues, such as a heart attack or ischemic heart disease. Conclusion. Atrial fibrillation is a common but serious heart condition that requires proper diagnosis and management. While some individuals may live without significant symptoms, others may experience debilitating effects. With the right treatment and lifestyle modifications, individuals with AF can lead a healthy and active life while reducing the risk of complications.
Thank you for watching. Please subscribe our channel.